So friends, today we'll discuss about the pathogenesis of acute glomerulonephritis. So what is the pathogenesis of acute glomerulonephritis? Today we'll discuss that. So as we discussed in our previous lecture that this infection is caused by the bacteria, that is the streptococci. This is the streptococci bacteria. So it enters the body. When it enters the body, human body, what happens in response to this bacteria, the human body start producing the antibody. And this antibody is directed against the structure of the streptococci, structure or the antigens of the streptococci. Against these antigens, these antibodies cross react with this antigen of the streptococci. Now this similar type of antigen is also present in our kidneys. In our kidneys this antigen is also present. So the antibodies which are formed by the human body against this bacteria, they also react with the kidneys, thinking it to be the streptococcal antigen. So as a result of which there occurs the inflammation of the kidneys and thus there occurs the glomerulonephritis. So the bacteria enters the human body, and in response to this bacteria, the human body start producing the antibody. These antibodies not only react with the bacteria but also cross react with our kidney and thus producing the glomerulonephritis. So this is a brief about the pathogenesis, and we now will see what are the strains. There are certain strains which cause these infection of the kidney, and these strains are known as the nephritogenetic strain. Nephritogenetic strains. There are certain strains of the streptococci which cause these inflammation. So we'll study what are these strains. There are certain strains of the streptococci which infects the throat, and certain strains infect the skin. This is the skin and suppose this is the throat, and those strains which affect the throat, they also affect the kidney, and they also cause the rheumatic fever. This fever is known as rheumatic fever. And the strains which affect the skin, they only involve the kidney but do not cause rheumatic fever, so it doesn't cause rheumatic fever. The strains which affect the throat, that is the strains which are causing the pharyngitis, they also cause the rheumatic fever and glomerulonephritis. And the strains of the streptococci which infect the skin, they also involve the kidney but they do not cause the rheumatic fever. So we'll study what are these strains. The strains which affect our throat and causing the rheumatic fever, the strains are the strain number 1 of streptococci, strain number 2, strain number 3, strain number 4, strain number 12, 25 and 49. These are the strains of the streptococci which causes the rheumatic fever, along with rheumatic fever cause the glomerulonephritis and involve the throat. And the strains which only affect the skin and the kidney, these strains include 2, 47, 49, 55 and 57 and 60. So the higher number strains usually involve the skin and the kidneys, while the lower number strain, as we can see here, 1, 2, 3, 4, they only involve the throat and they can cause the rheumatic fever. Very important. So the lower number strain cause the rheumatic fever, whereas the higher number strain don't cause the rheumatic fever. This is rheumatic fever. So this is brief about the pathogenesis. Now we'll see the pathogenesis of the clinical features. So now we will see the pathogenesis of the clinical feature. So as we discussed, these patients usually presents with the edema of the body. There is swelling of the body or the edema of the body. So we'll discuss why this edema occurs. This edema occurs because of the retention of salt and water. Because of the retention of salt and water in the body. Because of the retention of salt and water in the body, there occurs the edema. And also because of the loss of protein in the urine, there is a state of hypoproteinemia. Protein loss. Because of the protein loss, there occurs the edema of the body. So there are two things that can cause edema in the body. One is the retention of the salt and water, and another is the hypoproteinemia because of the loss of protein in the urine. Now other feature of clinical feature is, as we know, that it can also cause the increase in blood pressure. And why this blood pressure is increased, we will discuss it. This blood pressure is increased because of two things. First, there is activation of one system or axis, we can say, that is renin, angiotensin, aldosterone axis. So this axis is stimulated, and because of the stimulation of this axis there is increased blood pressure. Not only that, there is one more mechanism for causing the high blood pressure in this patient is because of the hypervolumic state, hypervolemia, because of the increased fluid inside their body because of the retention of this hypervolemia occurs due to the retention of salt and water. Due to the retention of salt and water, there occurs the hypervolemic state, and because of this there is increased blood pressure or hypertension. So there are two mechanisms for hypertension. First is the activation of the renin angiotensin aldosterone axis, that is the RAS system is activated, and because of the hypervolemia due to retention of salt and water. Now another clinical feature in this patient is the hematuria. There is hematuria. So why this hematuria occur? This hematuria occur because of the hematuria there is a loss of blood in the urine, and this occurs because of the inflammation of the glomerulus, which is the structure present in the kidney. Because of the inflammation of the glomerulus there is damage to the glomerulus, and because of this there is loss of RBCs in the urine, and that causes the hematuria. And another clinical feature which we see in this patient is the periorbital swelling or periorbital puffiness. Periorbital puffiness. So why there occurs the periorbital puffiness? The mechanism behind it, that this area behind the skin eyelid is very loose. Because of the loose skin tissue in the periorbital area, the fluid easily gets accumulated. First it is loose skin, and the fluid easily gets accumulated in the loose tissue. That's why there occurs the periorbital puffiness. Also there occurs the oliguria. There is decrease in the urine production, and it occurs because of the reduction in the glomerulofiltration rate. Because of the reduction of glomerulofiltration rate, there occurs the oliguria. Also there is one more thing is that they undergo in the later stages, there occurs the manifestation of uremia and ultimately renal failure, and it occurs because of the retention of urea, creatinine and nitrogenous waste products. And because of this retention of the urea, creatinine and nitrogenous waste products, the patient ultimately go into uremia and renal failure. So this was the pathogenesis. Now we'll discuss a little bit about the causes of red urine. Because our case patient usually suffers from the hematuria, we must be knowing other causes of red urine. So we'll discuss. This is a slight different topic from the topic, just we should know what are the causes of red urine. First, because of the loss of RBCs in the urine, the condition is known as the hematuria. It can cause red urine. Also because of the loss of hemoglobin in the urine, it can lead to the hemoglobinuria, and it can also impart red colored urine. Besides RBC loss and hemoglobin loss in the urine, there are other causes of red urine, like ingestion of certain beetroots. Ingestion of beetroots can impart red color to the urine, and also certain dyes which are used in the sweets. Whenever someone ingests beetroot or dyes, it can impart red color to the urine. So we'll discuss some other causes of red urine. So there are certain chemicals which are used as purgatives in purgatives, these are the drugs which are used for constipation, and in the purgatives there is one chemical which is known as the phenolphthalein, and this also chemicals impart red color to the urine, Now, one condition in which there is a loss of porphobilinogen in the urine, loss of porphobilinogen in the urine, which imparts port wine or red colored urine, and we know this condition, that is the port wine or red colored urine, and this condition is known as the acute intermittent porphyria. So acute intermittent porphyria can also impart red color to the urine. Acute intermittent porphyria can also impart red color to the urine. There is one more, there are certain drugs, we will discuss certain drugs that can impart red color to the urine. We have the drugs like the drug which is used for the leprosy, that is the clofazime, that this drug is used in leprosy and it can impart red color to the urine. Also one more drug, that is the rifampicin, very commonly used. It imparts, however, orange color, but slightly we can say it can also impart red color to the urine, and it is the drug used in tuberculosis. So two drugs, clofazime and rifampicin, impart red color to the urine. Now there is one more condition which is known as the alkaptonuria, and it can also cause red colored urine because of presence of homogentisic acid. It can also cause red colored urine. So this is brief about the causes of red colored urine. Now we'll summarize the whole topic. So we were discussing about the pathogenesis. How does the pathogenesis occur? Pathogenesis occur because this bacteria, that is the streptococci, it enters the body, and in response the human beings or the human body produces the antibody, and this antibody not only reacts with the antigen of the streptococci but also cross react with the antigens present on the kidneys, and that's thus causing the glomerulonephritis. And we will discuss the strains of which infect the kidneys. These strains are known as the nephritogenetic strains, and these nephritogenetic strains, there are certain strains which can cause rheumatic fever, and there are certain strains which do not cause rheumatic fever. The strains which cause rheumatic fever, they also cause the glomerulonephritis and pharyngitis, and the strains which do not cause rheumatic fever, they only involve the skin and the kidney. The strains which involve the skin and the kidney are 2, 47, 49, 55, 57 and 60, and the strains which involve the throat, that is they cause the pharyngitis or tonsillitis we can say, and these are the strains are 1, 2, 3, 4, 12, 25, 49. Now we'll also discuss the pathogenesis of clinical feature. So these patients have edema, and this edema occurs because of the retention of the salt and water inside the body, and also because of the loss of protein in the urine. The state is known as the hyperproteinemia. This hyperproteinemia and retention of salt and water can lead to the edema, swelling of the whole body. And also there is increased blood pressure. Our patient suffers from hypertension because in their body there is activation of renin-angiotensin aldosterone axis. This system gets activated, and also because of the hypervolemia, which is due to the retention of salt and water, and ultimately leading to the high blood pressure. Also this patient has red color urine or hematuria, and it occurs because their glomerulus are inflamed. There is damage to the glomerulus which causes the hematuria. And also because periorbital puffiness is because of the skin in around the eyelid is very loose, and the fluid easily gets accumulated in this loose skin of periorbital, and that leads to the periorbital puffiness. They also suffer from oliguria because ultimately their glomerular filtration rate is reduced because the glomerulus are damaged, and this ultimately leads to the reduced urine production. causing the oliguria. And in the late stages they undergo uremia and ultimately renal failure, and that leads to the increased accumulation of urea, creatinine and nitrogenous waste products inside the body. Now we have also discussed the causes of red colored urine. So the causes of red colored urine could be due to the loss of RBCs or could be due to the loss of hemoglobin. And the condition in which the RBCs are lost is known as the hematuria, and the condition in which the hemoglobin is lost, the condition is known as the hemoglobinuria. Also red colored urine can be due to the ingestion of the beetroots or due to the ingestion of the dyes which are used for making certain sweets, and certain chemicals like phenolphthalein which is seen in the purgatives which are used for constipation, and they can also impart red color to the urine. And one more condition in which there is a loss of porphobilinogen in the urine, and that imparts the port wine urine or red color urine, and the condition is known as the acute intermittent porphyria. And there are certain drugs which can impart red color to the urine, or the drugs which are used in leprosy, that is the clofazime, and rifampicin is used in tuberculosis, that can also impart the red color to the urine. And lastly, one condition known as the alkaptonuria, and they also have the red color urine, and it is because of the hemogentisic acid. So this is all about the pathogenesis and some causes of red color urine. So we will discuss other topic in our next video. Thank you.